Endometriosis is a condition which affects about 1 in 10 women, and it occurs when cells which are normally found inside the lining of the womb are found outside the lining of the womb. They're not identical, but they're very, very similar. And because these cells which are now outside the lining of the womb effectively respond to the same hormones as the lining of the womb, they unfortunately every month cause problems with pain or scar tissue or even internal bleeding into the ovaries. Unfortunately, endometriosis, as I said, is a very common condition. 1 in 10 women suffer with it. How much it affects people varies hugely, but it can affect every single aspect of someone's quality of life. It can affect, obviously, from pain, it will affect work, exercise, family life, relationships with both partners, but also with family. And it can also, unfortunately, affect fertility as well. In the mainstay, because endometriosis is cells which are like the lining of the womb that are affecting the inside of the pelvis, any treatment which actually affects your periods or makes your periods lighter will usually improve endometriosis as well. So hormonal treatments such as the combined pill or the progesterone only pill or other hormonal treatments which actually reduce your periods or even stop your periods will all massively improve endometriosis symptoms. Unfortunately, the hormonal treatments all act as contraceptive as well. And so if somebody's wanting to try and conceive, as well as trying to improve their endometriosis symptoms, there's a real balance to be had, because hormonal treatments will stop you conceiving. And in these women, the remaining treatments that can be used are essentially painkillers to try and control the pain and the symptoms, or surgery, both to diagnose, but also to improve the pain or symptoms from endometriosis. So mainstay treatment, hormonal treatment, also analgesics, but in women where these are either unsuitable or haven't worked, then surgery to treat the condition. Fortunately, endometriosis very rarely requires emergency treatment. Unfortunately, it's a long-term condition, a condition which can affect you for many, many years, and a condition that even with treatment can recur. Rarely does it require emergency treatment, but in a few instances where there's a massive flare in symptoms with extreme pain during periods or even extreme pain at any stage in the cycle, it can be due to ovarian cysts either increasing in size dramatically or very occasionally from actually ovarian cysts bursting. But this is a rare occurrence. Very rarely does it need any emergency treatment. And in the mainstay, endometriosis treatment can be planned and booked in a sort of elective or planned capacity. Surgery for endometriosis can be extremely effective, and some people can be curative, but we know that in a large number of women, surgery is only one part of the treatment to try and manage symptoms. And indeed, even after surgery, endometriosis symptoms can continue or can recur, and therefore sometimes successive treatments may be required. In the mainstay, surgical treatment is used for one, diagnosis, but B, treatment of endometriosis. We would usually try medical treatments first, so whether that's painkillers, but also hormonal treatments such as the pill, etc. But in women where either those aren't suitable or haven't worked, we would usually go for a laparoscopy, that's surgical treatment with keyhole surgery looking into the abdomen, and we would do that to diagnose endometriosis, but also to treat it. And the surgical treatment will usually be to either burn away or more frequently to cut away endometriosis. Occasionally, additional treatment such as removal of a tube or ovary or ovarian cyst can be required.